Well, I think everybody understands that both the health and the social care systems are very challenged at the moment because we have to achieve more with the same resources. And then, of course, added to that is the fact that our population, our community is ageing. And as they age, they pick up various pathologies and disabilities. And so the complexity of managing an older person with lots of different diseases and disabilities is the most challenging part of running the health and social care systems.
Integrated healthcare for workforce planning is a big issue, and the reason it's a big issue is that there are so many different organisations, disciplines and cultures involved, and in order to improve outcomes for patients, citizens and service users, we need to set aside those differences and look again at the way people work together. So what we've been doing over the past is identifying how to meet those needs, and this phase of the project is the development of a toolkit which will be put online and made available to all organisations so that they can download it at their workstation or on their laptop and use it to improve integrated discharge planning and to improve the way that they meet services for people in the community.
Integration is important for a number of reasons. Firstly, like many other countries, the UK has an ageing population. By 2033, almost 25% of the population will be over 60. It is integration between organisations that is the key to achieving effective health and social care support.
Can you tell me about what your experience has been using the health and social care system?
I was on holiday in Cheshire and I had renal colic, kidney stones, and it's extremely painful. So because I wasn't at home, I phoned NHS Direct. The really positive thing was when I was at home about 5 or 6 days later, I got a call from my GP surgery. I was a bit surprised by the speed of that communication, I must say, but it was very welcome.
The shift towards integration has profound implications for the workforce and for workforce planning. Different organisations work in different ways and will need to learn how to work together. People will need to learn how to work as part of an effective multidisciplinary team and in more flexible ways. So workforce planning across organisations will be crucial to the success of integration. And the Centre for Workforce Intelligence's Care Pathway Toolkit, developed in this project, offers a methodology and guidance for how to approach integrated workforce planning. So if you are a planner working in social care or in health, how do you move towards integrated care?
The team here at CfWI has been working with Cambridgeshire to understand their integrated discharge care pathway process and to understand the key workforce challenges and enablers of working in a more integrated fashion.
We decided to implement an integrated discharge team because without it there was a whole system going on of adversarial hands-off really, which is a bit complex and complicated and for all intents and purposes completely unnecessary. So without integration there was one team picking up some of the referrals, partially dealing with them and then sending them on to somebody else. But by integrating those two teams together, that handoff process could stop and a team picked up the referrals and deals with them.
Implementing an integrated discharge pathway in Cambridgeshire has involved many organisations working together to improve aftercare for people with complex health and social care needs. Senior members from these organisations meet every week to discuss how the care pathway could be improved and how any particular bottlenecks can be addressed. The meeting has been highlighted as one of the key success factors enabling Cambridgeshire to move towards integration.
The most useful parts of the toolkit is first of all as a whole system reviewing the pathways and the interfaces between the organisations, which has given us a wealth of information from all partners' perspectives.
And what we need to do with the information is ensure that that's informing our joint workforce planning over the next few years so that we really can provide a better experience for people as they move through the acute system and back out into the community and back home.
The Care Pathways Toolkit is web-based and consists of stages, with guidance about how to complete each stage, supported by tools, templates and examples. Through this toolkit, the Centre for Workforce Intelligence aims to provide you with a useful methodology to support planning for a more integrated and more effective health and social care provision.
Well, thank you for watching our film, and I do hope that what you've got from it is the opportunity to see how this toolkit might help you to deliver services for people in later life more effectively.